Hello students, this is Perio, Chapter 23, Lecture 1. Decision-Making Overview. This chapter is an important reference for the extra credit assignment in Perio. Clinical decision-making is a process whereby the dentist and dental hygienist use the information gathered during the clinical periodontal assessment to identify treatment strategies that meet the patient's individual needs. Responsibilities. It is the legal responsibility of the dentist to make a periodontal diagnosis. It is the responsibility of the dentist and dental hygienist to plan non-surgical therapy. It is the responsibility of the patient to participate fully in the treatment decisions and goals. Patients are followed for years or decades in most dental practices. Individuals' periodontal care needs change over time. A perfectly sensible periodontal diagnosis and plan for therapy at one point may require modification at a later date. Decisions related to assigning a periodontal diagnosis. Fundamental diagnostic questions for assigning a periodontal diagnosis. Does the clinical assessment indicate health or disease? If disease, is the disease gingivitis or periodontitis? And what type of gingivitis or periodontitis? Figure 23.1 on page 383 of your book shows a typical decision tree using 3 fundamental questions for determining an initial periodontal diagnosis. If there is health, there's no need for further diagnostic decisions. If there's disease, further decisions will need to be made. The decision is based on signs of inflammation. Signs of disease can be observed and measured by the clinician. Symptoms of disease are noted by the patient. Some patients are unaware of disease. Be sure that you understand the difference between signs and symptoms. Visible signs are color changes in the gingiva, contour changes, changes in consistency. Hidden signs include bone loss, exudate, and bleeding on probing. These hidden signs can only be detected with a periodontal probe and x-rays. Is the disease gingivitis or periodontitis? That question is answered by attachment loss. If there's no attachment loss, it is gingivitis. Attachment loss, it's periodontitis, and the bone loss can be seen on radiographs or through probing. Gingivitis, no loss of attachment. Periodontitis, loss of attachment and bone. What type of gingivitis or what type of periodontitis? We need to classify periodontal disease. Documentation is a critical skill for the dental team. We need to adhere to a standard format for documentation using correct terminology and including the correct descriptive modifiers. Disease severity and disease extent are shown in this graph. The descriptive modifiers for severity are slight, moderate, or severe. The descriptive modifiers for extent are localized or generalized. See page 386, table 23-2 for more information. The case type system for periodontal patients is limited in value and has been the standard practice in the United States, must be used in reports to insurance companies, but the case type alone does not specify precise periodontal disease classification. Case type 1 is gingivitis only, 2 mild periodontitis, 3 moderate periodontitis, and 4 severe periodontitis. Decisions related to treatment sequencing. A master treatment plan is a sequential outline of measures to be carried out by the dentist, the dental hygienist, and the patient to eliminate disease and restore a healthy periodontal environment. The treatment plan coordinates and sequences all treatment and patient education. It estimates the length of time required for comprehensive treatment and must be communicated with the patient. Patient consent for the proposed treatment must be obtained prior to commencing treatment. 5 phases of periodontal treatment plan. The assessment phase, which is the preliminary therapy. The non-surgical periodontal therapy is phase 1. Surgical therapy, if needed, is phase 2. Restorative therapy, phase 3. And periodontal maintenance is phase 4. Phase 0, assessment and preliminary therapy. This is where the data is collected and assessed. Care for immediate treatment needs such as emergency dental care, extractions, comprehensive clinical periodontal assessment, and this stage is also referred to as the emergency therapy. Phase 1. All non-surgical measures are used to control gingivitis and periodontitis, including periodontal instrumentation. Dental hygiene care and educational measures are taken. This is also called the bacterial control and anti-infective therapy phase. Phase 2 includes periodontal surgery, implants, or root canals. Phase 3, splinting of teeth, restorations, replacement of missing teeth by fixed or removable prostheses. Phase 4, all measures are used to keep periodontitis under control. This phase is used to maintain teeth functioning throughout life. The goal is to prevent the recurrence of disease. See page 388, figure 23.3 for more information. Documentation in the patient record should include all of the assessment data, all educational instruction, treatment services that were performed, and it is referred to as progress notes or chart notes. The 3 diagnostic questions that should be asked when assigning a periodontal diagnosis are: does the clinical assessment indicate health or inflammation of the periodontium? If there is inflammation, is it gingivitis or periodontitis? If it is gingivitis, what type is it? Periodontitis, what type is it? All aspects of periodontal treatment contribute to restoring the periodontium to optimum health. Communication and patient involvement are vital to treatment plan development. Informed consent. A patient's voluntary agreement to propose treatment after achieving an understanding of relevant facts, benefits of treatment, and risks involved is called the informed consent. This should also include alternative to the proposed treatment. Informed consent is much more than just getting a patient to agree to a procedure or to sign a written form. Informed consent is a process of communication between a patient and a healthcare provider that allows the patient to make an informed decision about his or her own dental care. Consent is informed only if the patient has been advised of recommended treatment, alternate treatment options, benefits, and risks of treatments. These are referred to as RBAs, recommendations, benefits, and alternates. The patient's consent must be voluntary. They must not be pressured into treatment. When presenting information to the patient, use language that's easily understood, simple, straightforward sentences, commonly recognizable terms, not jargon or technical terminology, and use a translator if the patient does not speak English. A person's legal right to direct what happens to his or her own body is the reason that we must have informed consent. It is the ethical duty of the dental health care provider to involve the patient in his or her own dental care. The scope of information that needs to be covered is the diagnosis and explanation of periodontal condition, an explanation of the proposed treatment, a description of the recommended treatment, a description of treatment alternatives, and a discussion of the known risks and benefits of the proposed treatment. The patient's role and responsibility during and after the periodontal treatment, the assessment of a likelihood that the proposed treatment will accomplish the desired objectives, the prognosis if no treatment is provided, the cost of the treatment, and reinforcing the right to refuse treatment. The format can be verbal or written. Written consent is a better legal document. Written consent should be signed and dated by the patient, the dentist, and a witness. Written consent is part of the patient's permanent dental record. Verbal consent should be documented in the patient progress notes or chart. Never guarantee the outcomes of the proposed periodontal treatment. A person's right to refuse all or a portion of the proposed treatment after explanation of recommendations, alternates, and consequences of declining treatment. Patients have the legal right to refuse proposed periodontal care. Clinicians must respect patients by fully and accurately providing information relevant to the patient's healthcare decisions. Voluntary acceptance by the patient of proposed treatment plan after all facts, benefits, and risks of the treatment have been presented. This concludes Perio Chapter 23, Lecture 1.